welcome back to the Human Wellness Journey. My name is Sarah Carter and I'm here to talk to you about plantar fasciitis or foot pain. A lot of people come into the acupuncture clinic with pain in the soles of their feet. They're often hopping from their bed to the bathroom in the morning or in the night because walking is too painful. Oftentimes this comes from poor footwear, as you could imagine, standing for long periods of time, maybe at work or for hobbies, and generally having really tight feet and calves. Sometimes it can even be the shin muscles or the fronts of the ankles where the pain is the most intensive. So I have a few tips for you today, things you can do on your own, and a few ideas that you could explore as well. So first I'll start off by showing you some acupressure. You should also know that acupuncture is great for this, so consider seeing an acupuncturist if your pain continues or you can't address it on your own. Also, plantar fasciitis, if you have it pretty badly, needs daily treatment. So take the time to do a little bit for your feet every day in order to get some relief. So first, one of my favorite points for this is kidney 1. It's right in the bottom of your foot, behind your toes, behind the big mound, just in the very middle. And what I like to do is to grab my foot in my hand and stick my thumb into that kind of hollow spot right underneath your toes, and pretty vigorously rub that. Really dig in there, feel a little bit of an ache. And you can do this anytime you're seated in a casual situation. Maybe you're watching a television program or something and you can sit down and really dig in here and spend a few minutes with some pressure. And I would say, as much pressure as you would use maybe massaging someone's shoulders or neck. Not enough to cause any sort of mark or lasting pain that wasn't there before. And really just dig in. And then with plantar fasciitis, I've noticed patients tend to have pain in one of 3 places. Sometimes the pain can be right here where we're rubbing, but that's probably the 4th or 5th most common place. Otherwise, more commonly is pain in the inner arch, pain on the outer layer, outer side, the pinky edge, or pain in the heel. And I've also noticed that pain tends to correlate with where the tightest spot or part of the calf muscle is. So if your pain is in your inner arch, spend some time working on your inner calf area. And really, self-massage is super effective. You can pinch into that and notice if there's soreness or a lump. And same with the outside of the foot. When it's the pinky edge, then we notice more oftentimes the pain is on the outside of the calf. You might have it on both feet, you might just have it on one. And as you explore here, you might find, oh, there's a knot or a soft spot, and perhaps even radiates down to the foot when you press on it. So it's a good indication that you're in the right spot. And you could use your roller, your foam roller. You could use a tennis ball, lacrosse ball, even a golf ball for the sole of your foot to rub on these various areas in order to break up the tight muscles that you found. Lastly, pain in the heel tends to be right in the middle of the back of the calf. And so massaging there behind the knee is another great way to release some tension. And self-massage is just one option. I also like to use my foam roller, lacrosse balls, tennis balls, as I mentioned, to roll across the backs of the calves. And if you find this to be really painful, you could even, I don't have a foam roller to show you, I apologize, but you could even just rest your calves on the foam roller as you distract yourself with something else that you need to take care of, just as a way to gently and slowly open them up without extra added pressure. Also wanted to show you a couple of quick stretches for the feet. So one of my favorite stretches for the feet is to come up onto your toes with your heels lifted. Just bring your body into a bit of a ball. Back up And so right here, you might feel quite a lot of stretch. You can use your hands to support your body weight and to balance you. Anytime you're in a stretch, I highly recommend focusing on your breath just to give your body extra oxygen, to help open the muscles. Also helps to distract your mind from discomfort and also helps you to just feel a little less discomfort. And then as you feel ready and able, and as long as this doesn't cause additional pain for you, roll up onto your tippy toes and push your heels down towards the floor. Go back and forth, rolling up onto your toes and then pushing your heels back down. And notice if there's any place in this motion, within this motion, that brings you more discomfort or feels particularly sore, particularly tight even. And just spend an extra couple breaths moving through any of that you find. If you're familiar with downward facing dog is a great way to stretch the bottoms of your feet as well as your calves. And for a lot of us, downward facing dog isn't accessible, so another great way is from plank pose. So if you step your feet back and you're in high plank, and then one great way is to rest one foot on top of the other. So you're getting a deeper calf stretch on the straight side. And you can really push through the heel to open the calf. And then you'll notice if you push back to downward facing dog, melt your heels to the floor, maybe stand on one leg and then the other. Depending on what's available to your body, this is another great way to open the feet. And find your breath, move back and forth, pedal out your heels. And you can make a bit of a routine with it. Bend your knees, come towards that ball position, press through the soles of your feet. And then lift your hips, melt your heels down, maybe pedal out your heels. And you can overstretch your body, especially when you're really tight. So make sure that you don't push your limits, that you give it maybe 10 minutes each day. And then another few options I'll recommend for plantar fasciitis, foot baths can be really helpful. Increase circulation and blood flow to your feet by warming them up in a hot foot bath. You could add in Epsom salt, which is a magnesium salt, also helps soften tight muscles as a way to help support your feet as well. Another great method to treat plantar fasciitis is to scrape the sole of your foot. And that might sound a little bit odd, but how this works is you take, my favorite tool is the back end, the soft handle end of a butter knife. So you take that side, and that's the side you want to make contact with your foot. And whether it's the arch or that space just above the heel, or be right behind the pad of your foot where I had you pressing for the acupressure, any of those areas are a great place to begin to scrape the foot. And you want to use some decent pressure, similar to how you would massage someone else's neck and shoulders, as we did before. And you're just going to repeat this over and over. Might use a little bit of cooking oil. You could use something that simple, or lotion that you have around, just to help the skin. But really what you're looking to do is push your comfort level, break up the adhesions and tension in the ligaments of the sole of the foot, increase circulation and blood flow to the area, and also bring the attention of your white blood cells, your immune system, so you can have some inside support for healing. So in recap, for plantar fasciitis, I love using rollers, balls, or other techniques for pressing, scraping, and moving manually the foot muscles, the calf muscles, and that whole area. Foot baths are great. Even ice can be helpful, but I wouldn't use ice often. As an acupuncturist, we tend to see ice as a trigger for more pain, slow circulation, great in acute situations, but not great for long-term use. Where heat through foot soaks, heating pads, increasing circulation through walking, stretching, these are great ways to help treat your plantar fasciitis. I would recommend that you give it at least 20 minutes of your attention each day and discontinue any techniques that increase your pain by more than 30%, either during or immediately after. I hope this helps you with your plantar fasciitis, and I look forward to seeing you again here on the Human Journey Wellness.